Did you know women are more likely to contract a urinary tract infection? This is because female anatomy increases the risk. The female urethra, the tube that carries urine out of the bladder, is shorter than the male urethra. It becomes easier for bacteria to reach the bladder. Given how easy it is to catch a urinary tract infection, it makes sense to look for home remedies to address the problem right from the beginning. But should you consider them? How can you prevent UTIs? In today's video, we'll be talking about urinary tract infections and how to treat them at home. Let's begin the discussion. UTI symptoms. Before we move ahead with the discussion about home remedies to treat urinary tract infections, we first need to learn how to spot one. Some of the most common UTI symptoms include a burning sensation while peeing, cloudy or dark urine, frequent urination, pelvic pain, urine with a strong odor, a feeling of incomplete bladder emptying. There are also certain factors that increase your risk of getting a urinary infection. If you have a history of UTI infections or indulge in unprotected sexual activity, you have a higher chance of contracting UTIs. Poor hygiene, certain medical conditions like diabetes, pregnancy, and structural problems in the urinary tract, like an enlarged prostate, also make you susceptible. There have been several cases where catheters led to UTIs. When you do catch an infection, it makes sense to reach out for antibiotics to deal with the menace. After all, around 95% of the UTIs are caused by bacteria. You'll be surprised to know there are several natural ways to help manage urinary infections and reduce the risk of their recurrence. Time to discuss some of the most reliable ones. 1. Hydrate. Do you drink enough water throughout the day? If not, you have to find a way to keep yourself hydrated. You'll be doing yourself a huge favor. And remember, you have to drink plenty of water, not sodas loaded with sugar. Your skin, your bladder, and your digestive system all will thank you. One of the biggest risks of urinary tract infections, UTIs, is dehydration. If you don't drink enough fluids throughout the day, you run the risk of catching bacterial infections. When you have enough fluids, you will urinate regularly. This will help remove the harmful bacteria from your urinary tract. As a result, your risk of catching an infection drops down drastically. But when you are dehydrated, there is no excess fluid to expel from your body. You won't urinate as often as you should, which means you are letting the urinary tract become a place where bacteria can thrive and cause infections. Various studies have found this to be true. One particular study was conducted among nursing home residents to see if fluid intake can help. The participants were given a schedule for fluid intake. The results showed the number of UTIs that required the use of antibiotics reduced by 58%. Another study was conducted among premenopausal participants who were prone to getting UTIs. The participants increased their fluid intake for a period of 12 months. The results showed the participants had a much lower frequency of UTIs. The best part is that staying hydrated does not require you to follow a special regimen. All you have to do is remember to drink water throughout the day. If you feel thirsty, don't ignore the urge and grab a glass of water. There are even apps to remind you to hydrate. If you dislike the idea of drinking plain water, you can make it fun by adding fruit slices to it. I particularly love fruit infusions in water to make it more appealing. Oranges, lemons, strawberries, cucumbers, and mint are some of the exciting options. You can prepare a jug of the fruit or vegetable-infused water by keeping it overnight in the refrigerator. You can also pick up a water bottle that has a built-in infusion basket for flavor on the go. One trick that has worked especially well for me is investing in a fancy water bottle. It serves as a visual reminder to drink water throughout the day. Go for the ones that have marked measurements for tracking intake. Mine has words of encouragement printed on the side as water levels go down.
Looking for answers on all the latest health and wellness news? Hit that subscribe button and join our millions of followers. Stay up to date on all our great Bestie content.
2. Vitamin C. If you want to protect yourself from UTIs, you should increase your intake of vitamin C. There's evidence that shows increasing your vitamin C intake helps you avoid getting these infections. When you take more vitamin C, it can increase the acidity levels of your urine. This helps kill bacteria lingering in your urinary tract. You no longer need to worry about catching urinary infections. Research has found this to be true. A study conducted among people who had undergone kidney transplants found pleasantly surprising results. During the study, Group A was given vitamin C intravenously, while Group B was given a placebo. It was discovered that Group A had far fewer bacteria in their urine than the placebo group. Another study was conducted to observe the benefits of vitamin C for UTIs. The results showed that combining vitamin C intake with other remedies, such as cranberry juice, was effective in treating recurrent UTIs. So, what should you eat to get maximum vitamin C from your diet? Luckily, there are several delicious natural sources of vitamin C. You can include grapefruit or oranges in your daily diet. Just one serving of kiwi fruit can give you the amount of vitamin C you need every day. If you aren't too enthusiastic about citrus fruits, veggies like red peppers are a great option. Broccoli is also rich in vitamin C. Have you ever wondered if you're getting enough vitamin C? Knowing about the signs of vitamin C deficiency can definitely help you stay alert. You can watch this video to learn more about vitamin C deficiency. 3. Cranberry juice. Looking for that one ultimate home remedy to fight off urinary tract infections? Cranberries are the way to go. They're great at stopping bacteria from sticking to your urinary tract. No wonder unsweetened cranberries are one of the most recommended home remedies. If you don't like drinking unsweetened juice, you can try the capsule form. So, what does science say about using cranberries to drive away UTIs? Research has found promising evidence. A study was conducted to see the benefits of cranberry juice among participants who recently had UTIs. Group A was given 8 ounces of cranberry juice for 24 weeks, while Group B was given a placebo. It was reported that Group A had far fewer instances of UTIs than Group B. Another study was conducted to see the benefits of cranberry products. It was discovered that the intake of cranberry juice and cranberry products significantly reduced UTI incidence annually. This was especially true in the case of people who experienced recurrent UTIs. Still not convinced that cranberries can be so efficient at preventing UTIs? Maybe the study conducted among people who experienced recurrent but uncomplicated UTIs will convince you. They were given cranberry supplements for 6 months. The results showed there was a marked drop in infections. Although cranberry juice is a good home remedy for UTIs, you should remember to drink the unsweetened version. Drinking cranberry juice that includes added sugar will do nothing for your UTIs. Instead, it may increase your overall calorie intake, leading to other health problems. 4. Probiotics. While we associate bacteria with all their evilness, there are healthy ones out there that boost your health. Your gut has healthy bacteria that contribute to digestion and boost your immunity. You can take probiotics to promote these healthy bacteria. You'll be surprised to know that probiotics are really good at treating UTIs as well. Make friends with probiotic yogurt and kombucha to get all the amazing benefits. But how does a probiotic help fight off urinary tract infections? See, when you have a UTI, bad bacteria replace the good bacteria in your urogenital system. Taking probiotics would help restore the good bacteria and prevent future instances of UTI. Science supports this claim. Research was conducted to see the benefits of probiotics on UTIs. For this, different probiotic strains were used. The results showed that all of them helped reduce the chances of getting UTIs. Probiotics can be taken while you are on antibiotics to treat UTIs. In fact, that would even be better, as antibiotics create an imbalance in your gut bacteria. Taking probiotics would help restore the healthy bacteria in your gut. 5. Healthy hygiene. If you are trying to prevent UTIs and their recurrence, you'll most likely focus on eating the right foods and taking the right supplements. But it's not sufficient. You also need to practice healthy hygiene and develop a few good habits to keep infections at bay. The first thing to remember is not to hold your urine for long periods of time. as this increases the buildup of bacteria. As a result, you'll be more susceptible to infections. If you're someone who's prone to UTIs, emptying your bladder frequently would be very helpful. You should also avoid contraceptives such as spermicide. Research says there's a link between using spermicide and an increased incidence of UTIs. Women should wipe from front to back after relieving themselves. Research suggests that wiping from back to front causes bacteria to reach the urinary tract, which increases UTIs. 6. Some more tips to keep UTIs away. There are a few other things you can do to reduce your risk of getting UTIs. You can try natural supplements, like bearberry leaf and D-mannose, to decrease the risk. But make sure you speak to your doctor before including any of these supplements in your daily routine. Wearing loose-fitting clothing and using cotton-lined fabrics can also be helpful. When you wear tight-fitting clothes or use non-breathable fabrics, they can trap moisture in the genital area. This creates an ideal environment for the harmful UTI-causing bacteria to multiply. You should try to avoid foods and drinks that irritate your bladder. We're talking about limiting your intake of beverages like coffee and soft drinks. Too much sugar in your diet can be detrimental to your bladder. If you're experiencing discomfort in the bladder region, a hot compress can help. You can use a hot water bottle for this. A heating pad would also be helpful in reducing pain. Most importantly, if your doctor has prescribed you antibiotics, take them without fail. Interested in knowing more about your bladder health? Let's keep the conversation going with a couple more videos. Shall we? Watch What the Color of Your Urine Says About Your Health. You can also try our video on 5 early signs of bladder cancer mostly ignored by people. Go ahead, click one. Or better yet, watch both and learn more about how your body works. Did you ever get a urinary tract infection? Let us know in the comments below.